everyone, thank you so much for watching. My name is Taylor and today I want to share with you something that happened to me recently, and that was I had a hemorrhagic cyst burst on my ovary. And the reason I want to talk about this today is because I'm really interested in women's health and I talk frequently about hormones, my experience with my menstrual cycle, PCOS, and vitamin D deficiency. And I feel like women who have PCOS are prone to having cysts on their ovaries and also may have experienced a cyst burst, possibly even an hemorrhagic cyst like I had. So I'm just going to talk to you about what happened and my recovery after surgery and everything. So that's basically what I'm going to talk about today. So hopefully this can help some of you who are watching, and here we go. So when I had the cyst, I had no clue what was going on. Everything happened like really quickly, very suddenly, and it was all pretty shocking for me. So how it started was I had this really sharp pain in my pelvic area. And it didn't feel like cramping, and I didn't know what it was, but I thought I might have just pulled like something in my groin. I had worked out the day before lifting pretty heavy weights on the squat rack, and I thought maybe I just like pulled something and I'll take some medicine, and thought the next day I would feel fine. Well, the pain started around 7 p.m. at night, and I took a couple ibuprofen, used a heating pad, and it really wasn't helping at all. So I could barely walk. Like, the pain felt like a stabbing pain straight through my pelvic area, like all the way through, and it was just something that I had never experienced or felt before, and I couldn't explain it. It didn't feel like cramping, but again, I just thought it would go away on its own, so I just tried to let it be and thought it would pass. So I go to sleep, and a few hours later I wake up to go pee, and I get up, I go to the bathroom, and I come back to my bed and I can't like lay down. Like, my abdomen hurt so bad at that point that I couldn't use my muscles and I couldn't lie back in my bed. So I stood up and I felt like I was gonna faint, and the pain had moved from my pelvis up into my abdomen. And I lived with my parents, so I went and I woke up my mom and I said, I told her what was going on, and the pain was so bad. And I like never go to the doctor for anything other than like my normal routine checkups, and I do pretty good with pain, and I'm pretty healthy. Like, I don't get sick. I never go to the emergency room, anything like that. Even when I am sick, I'm like, ever since I was a little girl, I never liked taking medicine. I would rather just like, get through it. So when I told my mom I thought I had to go to the ER, she knew I was like serious and in a lot of pain, and I told her I couldn't wait to go to urgent care the next day because it was at 1 a.m. So my boyfriend, who was also staying with me at the time, drove my mom and I to the emergency room, and luckily, because we went at 1 a.m., there wasn't a lot of people there. And actually, before I left, I took 2 more Tylenol. So at home I had taken a couple ibuprofen, which didn't really help the pain. Then I took a couple Tylenol. Thank goodness, because that like helped me get to the emergency room without like struggling through all the pain that I had been having. So I make it to the emergency room, they check me in and everything, and because it was slow, I was able to get into a bed like right away. And they knew I was in a lot of pain. I told them it was in my pelvis and it had started to move up to my abdomen. And immediately they, took all my vitals. My blood pressure was like 107 over 70 or 80, or maybe 107 over 60, I don't know, can't remember. But they took my blood pressure. All my vitals were normal, but they knew I was in pain, so they gave me some fluids and some morphine. I never had morphine before, so I was like, can I just have a little bit? Like, I don't want to take too much, but they gave me like the normal dose of morphine. So we're waiting there in the ER, and then they come and draw my blood. So I have an IV in this arm, and then the other arm they're taking like 5 vials of blood. And the pain just keeps getting worse, and at that point I like could barely breathe because the pain had gone up to like my rib cage, and it felt like my muscles in my abdomen were just clenching so tight, like as hard as my muscles could squeeze, and it was so debilitating. It would come in like a sudden like rush too. Like the pain was constant, but then every like 20 minutes a really, really sharp burst of pain would come, and that was like when I couldn't even expand my lungs at all. I couldn't breathe, and that would last for maybe 5 to 10 seconds. And then they ended up giving me more morphine for the pain, drew my blood again, and I didn't know what they were drawing blood for, but eventually they told me that my blood count, my red blood cells, or no, it was my hemoglobin levels were dropping. And since they had already drawn my blood a couple times, they eventually did like a hemoglobin. They can measure that with just like a teeny bit of blood from the prick of your finger, and that was pretty low as well. So normally they send up like the vial of blood that they take from your arm. They send it up to the lab and get a measurement that way, which is a lot more accurate than the little finger prick, but it still like, you know, gives like some sort of estimate of what my blood levels were. So after being in the ER for probably like 4 hours, they gave me more pain medication, but my blood pressure, they noticed, was starting to drop. So they gave me fentanyl instead of morphine, and I'm sure the pain medication helped with the pain a lot, but I was still in a ton of excruciating pain, like probably some of the worst pain that I've ever felt in my life. And it took away the pain that I had in the pelvis, like the sharp stabbing pain, but the pain in my abdomen all the way up to my rib cage was not going away. And then I found out I had to be transferred over to the hospital next door, which if you live in San Diego, you've probably heard of Sharp Mary Birch, and it's where a lot of women go to give birth and do pregnancy related things. But they wanted to move me over there, and my ER doctor told me I actually had a cyst burst on my ovary. Actually, let me back up. So while I was still in the ER, they had given me pain medications, drew my blood, saw that my blood levels were dropping. They also had me do a CT scan on my stomach, and that was also pretty painful. Not the CT scan itself, but just the fact that you have to lay flat when you're in a CT scan. And when I laid back, the pain was even worse in my stomach, but I was able to get through it. And then after that, they had me do an ultrasound. So I had to use the restroom. They wanted me to go pee first so that you can empty out your bladder before the ultrasound, so they can have a better view in your stomach and of your ovaries and the uterus. So they had me go pee, but I couldn't even pee. Like, I couldn't push anything out to empty my bladder. So I literally just sat on the toilet, let like a trickle of pee come out, and then, or a tinkle of pee come out, and then that was it. So I knew there was still pee in there, but I literally could not push anything out because it hurt so bad to like use my abdomen. And so she did the ultrasound of my stomach, and then they do a vaginal ultrasound to look at your ovaries. Once they got these results back, they were able to see that I actually had a cyst on my ovary that had burst. And my ER doctor told me that it is common. There are people who have cyst bursts on the ovaries, but there's different types of cysts, and some cysts burst and then it causes some pain, like a lot of pain in the pelvic area, and then it goes away. And then there's hemorrhagic cysts, which burst and then cause a lot of blood to be released. And sometimes the blood is just a little amount so your body can reabsorb it, and they'll give you pain medication, but you can go home and you're fine after like a day. In my case, I had a hemorrhagic cyst, but it wouldn't stop bleeding. So I had blood continuously leaking from where the cyst burst into my abdomen, and the blood in my abdomen is what was causing all the pain. So they moved me over to Sharp Mary Birch to what I thought was just to recover and get through the pain for a few more hours, and then I thought they were going to send me home. Well, I get over there, I'm still in a ton of pain after 2 morphine doses and a fentanyl. And so I talked to this new doctor, and she was really nice, didn't examine everything, and then told me I would need surgery. And at that point, my blood pressure was already down to 93 systolic, which is very low. My hemoglobin had been continuously dropping, so they could tell that I had internal bleeding. And I just didn't expect to have surgery. And then, of course, she tells me, okay, there is a risk, like, they have to let you know, like, all the possible outcomes of surgery, and you have to consent to let them do the surgery. So she explains to me the risks, and those are you know, stopping the bleeding, removing the blood from my abdomen, but then along with that they look at your ovaries, and if there's anything wrong they have to address that as well. If there's like, if they have to remove the cyst, they will, or they'll just cauterize it to stop the bleeding, and then they look at your ovaries, and if they have to remove the ovary, they will. So that's nothing a girl wants to hear, that you might have to lose an ovary. Like, I don't have kids yet, that's scary, and yes, you have 2 ovaries, but that's not something anyone wants to go through, is like giving up an ovary. So I'm really scared. Although I knew I was in good hands, like I felt really safe and comfortable with all the nurses and doctors who were taking care of me, but it was just, it all happened like so fast. So they gave me another dose of morphine and then start like getting me ready for the operation. So I get moved to the OR, and I got to see my family and like my best friend right before the surgery. So after going through all of this, I just realized how important it is to have people in your life who support you. Before I knew it, I was on the operating table, and they did a laparoscopic surgery where they used just 3 small incisions on your stomach to go in there and stop the bleeding on my cyst, or the ovary where the cyst was, and then they take all the blood that had leaked into my stomach, they suck it all out. And I guess the surgery only took like 45 minutes, which seems like really quick to me, and then in total I think I was in recovery and surgery for about 3 hours. So after that I got to see my family again. I went home, and basically after surgery it was just like time for me to rest, get through the pain. I did have a lot of swelling in my stomach and bruising in my stomach, on my pelvic area, and then that swelling and bruising, I still have a little bit of bruising, but the first week my stomach felt so swollen and bloated, like felt huge, and I was just really uncomfortable. Plus I had a lot of pain, so they send you home with Norco, which is a pretty strong pain medication. I took that for only the first like 2 days, and then I took ibuprofen for a week and a half, and now it's been, I think, 3 weeks. It's been 3 weeks since my surgery, and I feel like 95% better. I still have a little bit of bruising and like tenderness in my stomach, but almost back to normal. So my doctor did tell me that I could go on birth control, and that would hopefully prevent this from happening again. And I am meeting with my doctor next week to discuss birth control options, just to help regulate my hormones. And I haven't been on birth control in about a year and a half, and I've been trying to avoid birth control just because when I used it in the past I didn't really like it, and it just kind of, I don't know, I guess I didn't really fully believe in using birth control. But if it will prevent me from having to go through this again and having another hemorrhagic cyst, then it's something that I'm definitely willing to do. So the doctor did say that I only had that 1 cyst on my ovaries, the one that had burst, and I saw a picture of it, and it looked like a huge freaking cyst, like probably the size of my ovary, if not bigger. And they didn't remove the cyst, but they stopped the bleeding. The cyst should go away on its own. And it was really interesting though to find that I had a cyst on my ovary, because while I was diagnosed with PCOS, or polycystic ovarian syndrome, a few years ago, I never knew if I actually had cysts on my ovaries. So now I know I had 1, which I guess is better than having like a ton of cysts, because that is possible as well. And then also during the surgery they pulled the blood out of my stomach that had leaked from the bursting cyst, and it was 1 liter of blood that they sucked out, and that's like 20% of the blood in my body, which is why my blood pressure had dropped so low. So that was really interesting too to find. I hope that this video was helpful for women or girls who are watching this, and if you have any questions, please feel free to email me, taylorannhealth@gmail.com. You can also message me on my Instagram, Sweet Soul Life, and Also, if you want to hear more about if I decide to go back on birth control and which birth control option I choose, let me know. I can always make another video about that, or just like talk to you about it via email or messaging. But again, I hope this was helpful for you. I don't want to scare women who have a cyst, because not all cysts that burst are, you know, lead to surgery. Sometimes they just burst or they just go away on their own. But if you have gone through this, have had a hemorrhagic cyst, like, I don't know, maybe it just happened and you're still in a lot of pain from it, just know that you will get better, the swelling will go away, and take the time to relax and recover. But anyways, I really hope to hear from you. Thank you so much for watching, and I'll see you next time.